Health Minister Dr. Phaahla says hospital admissions in children under 5 due to COVID-19 have decreased after a spike in early November. This especially in the Tshwane Metro, where hospitals were where there was an earlier resurgence that occurred.
During the 3-week period from 14 November to 4 December, there has been an increase in admission of children under 5 years. This has been observed in the Tshwane Metro hospitals, where the early resurgence has occurred. Children 18 years and younger comprised 21% of admissions during the early period. However, this pattern has changed over the subsequent time from the early days, and the proportion of admissions in children less than 5 years in total admissions has decreased to 14%. It was 21, then 14% in week 46, and currently it's even lower at 8%. So this seemed to have been the phenomenon early, but it has now changed to more adults getting infected.
Now, for more on the story, I'm joined by Professor Mignon McCulloch, the chairperson at the SA Paediatric Association. Professor, thank you so much for your time and welcome to the Daytime Update. This, of course, is a concern, isn't it, where we are now seeing children that are getting this virus. But from what you have seen, why is it that children are now getting this virus, and how is it dealing with their bodies, or how are they being able to fight it off?
So thank you very much for having me on your show. And I think it's actually good news, because if we listen to what the Minister said, the number of children being affected is actually decreasing. So what we're seeing from this Omicron variant is that it seems to be quite contagious. And so it's contagious for everybody, the whole population, the elderly, adults, teenagers, but also to children. And I think there was quite a large amount of panic in the last 2 weeks, where there were concerns that many children were being infected, and there was a worry that many children may be admitted to hospital or even to intensive care. We've monitored the situation very closely in the last week, and we are expecting the figures today. So the National Institute of Communicable Diseases do their maths on a Friday afternoon. But what I'm hearing from all my colleagues in pediatrics and in intensive care around the country is that there are very few children who are going to intensive care or needing oxygen or ventilation or life support. What we are hearing is that the number of the population in general, not just children but a lot of adults, have also contracted COVID. And so this is a concern. It's also resulted in the government agreeing to give all teenagers now a second dose of the Pfizer vaccine. But it just shows that we're in the middle of our fourth wave. People need to vaccinate. People need to wear their masks, sanitize, and be really careful about social distancing. And that's hard, because a lot of the children and the teenagers have just finished their school year, and so they want to get out there and see their friends. And we really need to be careful about that. But fortunately, it's summer, and so hopefully people can socialize outdoors. But we've been quite cautious. Obviously, I don't have a crystal ball, but we were quite concerned that there was a lot of panic and a lot of media hype about the fact that there were hundreds of children being admitted to hospital, and that has not been the case. We have not seen that. There have been lots of children coincidentally having COVID. So if you've had a broken arm or you've come in for tonsils or dental extraction, when they test you, they found that the kids have been positive. But this has been a reflection of what's going on in the community as a whole. A lot of those children have been almost asymptomatic and have just had an incidental finding of COVID. So I think it is tentative good news. I'd like to see the stats later today from the NICD, but the Minister has alluded to the fact that the percentage of children affected has gone down from almost 20% down to 8%. And as pediatricians around the country, we have been monitoring the situation, discussing with each other where we are, and it seems like the hospitals are not swamped with children. There may be some children being admitted, but the intensive cares are not being swamped. But I think it just reminds us how really important the vaccine is, and there's some interesting work coming out of KZN, out of their research laboratories, where it shows that the Pfizer vaccine is indeed really good for this variant as well. So bottom line, vaccinate, and just wear your masks, social distance, and be careful. If anybody is sick in the family, you need to think about COVID at this time of the year.
Professor, at what age group are we looking at when we speak about these children that we are seeing getting the virus or actually being hospitalized? What age group exactly are we sitting with now?
So it was throughout from 18 and less, and so there was about 10% in kids under 5 and then another 10% of kids up to the age of 9. But the numbers are not overwhelming. So, and that's really important that people realize that there are not hundreds of children being admitted to hospital. And those that are positive in hospital, at least 50% of them have come in with an incidental medical problem, such as broken arms, being fallen off their bike, being in a car accident. So they have not actually presented with a cough or a cold or any infection. I think if parents are concerned about their kids and feel that they are not well, really important for them to seek medical attention, be that the local clinic, their GP or their pediatrician. So we're not saying that parents can just sit back and relax, but it seems like the situation is not as severe as I think the concern was 2 weeks ago. But it is still early days. Today is an important day because later today the stats will come out. But hearing early reports of the stats or later this afternoon, things seem to be improving on the children's front. On the adult side, you've seen the numbers in total, 22,000 yesterday, I think. And that just means that we just don't have enough people vaccinated. So really important for people not to feel scared of the vaccine. It's a safe vaccine. There's no conspiracy theories. The vaccine's overrated. It can't do all those magical things that people are concerned about. This is a vaccine against the COVID virus, and it appears to be fairly successful against the new variant as well, which is good news for us. So as a population, we need to get our vaccine numbers up. We're very fortunate in South Africa to have vaccines. Many of our neighboring countries in Africa do not have access to the vaccine. So people need to go as a whole family and go and get themselves vaccinated. And the teenagers can now have their second dose of the Pfizer vaccine as well.
I'm glad you're mentioning that second dose, Professor, because there was an uproar when the decision was made for children that they're now being able to get the first jab of the Pfizer vaccine. As the SA Paediatric Association, what is your stance on the second vaccine and the possible side effects that it could have on such young children?
So the good news is that we've been able to watch what's happened in the rest of the world. And in the rest of the world, there have now been millions of teenagers who have actually successfully and safely had 2 doses of Pfizer. So in the US and in the whole of Europe, Italy, for example, has had up to 80% of their teenagers already double vaccinated. So there were some concerns about the side effects if a second vaccine was given, but those have not proved to hold any truth. And so on the whole, children have been very safe getting 2 vaccines. And it's quite good trailing behind the rest of the world because in many ways we can see what problems they've had and we can learn from that. But the feeling now worldwide is that it is completely safe for 12 to 17-year-olds to have 2 doses of Pfizer. And Pfizer in the US has now also had approval for children younger than 12, so the 5 to 11-year-olds as well. They're just needing to finalize what dose they need to get, because obviously smaller children need smaller doses, but definitely 12 years and up, everybody should go and get their vaccine. And you know, if you're worried that kids are getting sick and the community is getting sick, but people don't actually take the vaccine seriously, that is a little bit crazy. So we're saying stay calm, watch out for everybody. Any cough, cold, or runny nose or headache at this stage could be COVID. And if you are vaccinated, it's definitely shown a difference. You are definitely protected if you've been double vaccinated. And the chances of you ending up in hospital, you, your parents, your uncle, your aunt, or even your children is very low to get a severe illness if you've had 2 vaccines.
Professor Mignon McCulloch, thank you so much for your time, the chairperson of the SA Paediatric Association, talking to us about children now getting this COVID-19 vaccine. And in the next hour, we'll be having a conversation with the Gauteng Department of Health around what the hospitals are looking like at the moment.